Good day everyone, I'm Fujin, one of the members from Group 2, including Alicia, Yihan, Charlotte and Yushen. As for today, we, as Group 2, are going to discuss various points that we discovered from a case study regarding a 64-year-old woman who was sent to the emergency room after experiencing increasing shortness of breath and weakness. Based on the physical examination, the 64-year-old woman looks drowsy and pale, although she was found to have normal pulse rate, temperature, liver position, and consistent femoral and radial pulses bilaterally. There were several symptoms, signs, and peculiar readings which were present as well. This includes blood pressure and respiration rate being higher than normal, swollen neck veins, lateral displacement of heart apical impulse, swollen abdomen, and also pitting edema of both legs. The differential diagnoses that can be made based on the peculiar readings of blood pressure being higher than normal are coronary microvascular disease, kidney problems, aneurysm, or stroke. Whereas for high respiration rate, it might indicate that the woman is experiencing dehydration or infected with respiratory disease or heart disease. From other physical findings, distended jugular veins were noticed, which serves as a key symptom to congestive heart failure and cardiovascular diseases. Lateral displacement of heart apical impulse normally indicates cardiomegaly, which is the enlargement of heart. Distended abdomen commonly indicates organomegaly, which is abnormal enlargement of organs, or ascites, where fluids collect in spaces within the abdomen and cause dull percussion. Also, pitting edema of both legs were discovered, and it mostly point towards congestive heart failure or a blockage of the leg vein. Looking at the clinical history, the woman had experienced multiple transient ischemic heart attacks, which normally leads to congestive heart failure. Her father was positive for lung carcinoma, while mother was positive for colon carcinoma. In terms of the possibility of disease inheritance, overall, the woman still has a relatively low risk to develop lung carcinoma. It's not guaranteed that she will develop lung cancer just because her parents or sibling did. Study shows that only 8% of cases of lung cancers are hereditary. However, she has a higher chance to develop colon carcinoma. Hereditary factors account for 5 to 10% of colon cancer cases. Your lifetime risk rises to 10 to 20% if you have a first-degree relative with colon cancer before age 50. Due to shared genes and comparable behaviors, family history is a significant indicator.
Let us discuss the abnormalities detected according to the results provided. Firstly, after investigating the radiograph of the patient's chest, diffuse bilateral infiltrates have been detected. Besides, there is also fluid accumulated in the lungs. This indicates one of the symptoms for pulmonary vascular congestion, which leads to impaired gaseous exchange brought on congestive heart failure. Creatinine, blood urea nitrogen, calcium, albumin, and BNP have abnormal values in the general biochemistry test, whereas remaining results are within normal range. The creatinine level is above the normal range. Many heart failure patients also have higher creatinine levels. Renal failure is the major cause of this condition. Blood urea nitrogen for the patient is 24.3 mol per liter, which is above the acceptable reference range. With a reading of 175 millimol per liter, an increased calcium content has been found. Aging increases the parathyroid hormone, which encourages the calcium release into the bloodstream, resulting in weaker bones. Although the value is excessively high, the anomalous result could be the consequence of technical issue. Severe hypocalcemia is already defined as calcium level exceeding 3.5 millimol per liter, which can cause a result in kidney stones and impaired cardiac function. Additionally, the BNP level is extremely high, indicating that the heart's pumping function is impaired. Furthermore, a low albumin level is discovered. A positive result is also achieved for the stool or cord blood test. This suggests that there is gastrointestinal bleeding since there is blood in the stool that cannot be seen in naked eye. This also suggests iron deficiency anemia as there is no hemoglobin count is below average. Additionally, low hematocrit count is also noticeable, which may be due to the red blood cell, hemolysis, malnutrition, or the bone marrow inability to produce new red blood cells. Additionally, the patient's mean corpuscular volume is too low, indicating that the patient's normal red blood cell is lower than usual. The test also shows low levels of average blood hemoglobin level in cell, and the mean blood hemoglobin concentration in red blood cells also is low. According to these results, they indicate that the patient has deficiency in iron, which causes microcytic anemia. The patient's platelet levels are also too low, as platelets are very necessary for blood clot to form halt in bleeding. This disease could result in excessive bleeding. Bicarbonate levels in the patient's blood within normal ranges, but the high partial pressure for carbon dioxide, low partial pressure for oxygen, and oxygen saturation is discovered. These symptoms point to a respiratory acidosis. A cancerous condition is also present when the tumor marker CA exhibits an abnormal value. It works by connecting the membrane of the tumor cells. The lesion on intestinal membrane in histopathology image 1 is well to moderately defined. This shows an invasive adenocarcinoma in the form of a grade 2 tumor that is gradually expanding and beginning to spread. The 3 images show no granuloma or inflammatory alterations. Since benign tumors seldom develop ulcers, it is possible that the patient has colon cancer or also can known as colorectal carcinoma. But the examination, both impaired heart pumping function also indicates the patient have heart failure. Next, iron deficiency also contributes to the microcytic hypochromic anemia diagnosis. Lastly, high pH in blood shows respiratory acidosis properties.
Colon carcinoma is the common malignant tumor of the digestive tract that occurs in the colon. The primary types of colon cancer include adenocarcinoma, mucinous adenocarcinoma, and undifferentiated carcinoma. The incidence of colon carcinoma is mainly related to high fat and low fiber diet. The key traits of the cancer are postulated by both environmental and genetic factors that lead to colon cancer, which stimulates oncogenes and inactive tumor suppressor genes by gradual accumulation of genetic changes. 3 types of pathway will be observed, which is the traditional, alternative, and serrated pathway. Firstly, for the traditional pathway, it commences in the ordinary mucosa and progresses through the tubular adenomas ultimately. Then, the colon carcinoma spreads through the normal mucosa in the alternative pathway. Last but not least, it commences in the ordinary mucosa, leads to colon carcinoma in the proximal colon, and has a favorable prognosis in the serrated pathway. As for the symptoms, also be classified into 3 stages, including the early, normal, and late stage. In the early stage, there will not be any symptoms, which also known as asymptomatic. The symptoms that might be experienced in the normal stage are constipation, excessive gas, abdominal pain, and cramps. People may already have an advanced form of the disease if they exhibit these symptoms. And for the late stage, symptoms such as vomiting, excessive fatigue, or diarrhea can be notified.
Colon cancer can be diagnosed using a variety of laboratory tests. These tests can be broadly classified into 2 types, which are stool-based testing and visual examination. The diagnosis of colorectal cancer is made using a variety of procedures, including the stool test, wire-based fecal occult blood test, and fecal immunochemical test. To find out if there is a hidden blood in feces, conduct the fecal immunochemical test (FIT). The principle of FIT is the detection of blood brought on by the weakening of blood vessel in colorectal cancer as the stool passes through. FIT tests produce more reliable findings since they are unaffected by medicines or diets. Continue with the wire-based fecal occult blood test (GFOBT), which, similar with the FIT test, utilizes stool samples to identify occult blood but cannot determine whether the blood comes from the colon or stomach. GFOBT functions differently with FIT. The stool DNA test, which takes the patient's feces and examines it for indications of gene mutation in colon cancer cell, is the last test based on stool. This is due to the fact that colorectal cancer altered DNA or gene will enter the stool and leave the body during identification. For visual examination, colorectal cancer investigation typically involves the use of computer tomographic colonography, colonoscopy, sigmoidoscopy, and biopsy. Using specialized X-ray equipment, the large intestine is scanned for cancer using the CT colonography technique. During colonoscopy, a flexible ladder tube is introduced into the colon. The sigmoidoscopy is another visual examination that works similar with colonoscopy. Biopsy is the final visual inspection used. A little sample of colon tissue is removed during the biopsy in order to be examined under a microscope. Next, I will present the type of anemia of the patient and its etiology. The type of anemia in the patient is microcytic hypochromic anemia, as evident in her complete blood cell count test by her low hemoglobin level, low concentration, and pale color of hemoglobin, which defined as hypochromic, and smaller red blood cell, which mean microcytic. The woman's continuous blood loss because of colon cancer may be the etiology of a microcytic hypochromic anemia. This will then result in iron shortage, which is one of the factors that contribute to microcytic hypochromic anemia. Iron shortage can also be caused by a reduction in battery iron and insufficient iron absorption. Her body is unable to generate sufficient hemoglobin or red blood cell, which result in low red blood cell count and low hemoglobin concentration. Her body will gradually become less efficient at transporting oxygen, which will make her breathlessness.
Cardiac failure is a group of signs and symptoms that occurs when the heart is unable to pump blood forwards and quickly enough to fulfill the body's metabolic needs. It can only do under a very high cardiac pressure. The body will compensate in several ways, such as constricting the blood vessels to maintain blood pressure, to compensate for the heart's diminished strength, or to divert the blood away from less important tissues and organs. However, the heart will continue to become weaker and worse until this compensating process no longer is working. For the pathophysiology part, cardiac failure is caused by systolic dysfunction and diastolic dysfunction. For the etiology, there are many causes of cardiac failure, such as family history, narrow artery, high blood pressure, coronary artery disease, myocardial infarctions, valve disorder, diabetes, obesity, kidney disease, hypothyroidism, or toxin. And for the symptom, includes pitting or non-pitting edema, enlarged tendons, liver, engulfed neck, vein, pulmonary valve in various combinations, and shortness of breath. Moving on to the manifestations of left and right cardiac failure. Cardiac failure depends on the size of the heart as it will produce different types of signs and symptoms. The heart is divided into a left and right sides, which both sides carry different types of blood to different parts of the body. Left side's heart failure would result in a decreased cardiac output and oxygenated blood that is pumped out of the heart to the body, causes the patients to experience hypoxia as there is insufficient oxygen to body tissues. And for the right side's heart failure, it happens when the right ventricle of the heart is unable to adequately pump blood to the lungs. As the blood pressures rise in vein, the fluid is driven onto the blood tissues. Furthermore, to the etiology, systolic dysfunction is the decrease in blood injections capacity due to the impaired ventricular contractility and is increasing the afterload. Diastolic dysfunction is a result of impaired ventricular relaxation and increased stiffness of the ventricular wall, which results in impaired ventricular filling.